Hi, my name is Kate Rice. I'm a Board Certified Behavior Analyst and a Behavior Consultant with Brett DiNovi Associates. Today, I'm going to be talking about anxiety. According to the Anxiety and Depression Association of America, anxiety disorders are the most common mental illness in the United States, affecting more than 40 million people over the age of 18 each year. That's 18% of the population. Common signs of anxiety include insomnia, rapid heartbeat, procrastination, seeking reassurance, sweating, avoidance, overthinking, and those are just to name a few. Anxiety sucks. Our body's responses to the feelings of anxiety are exhausting and force us to miss out on the people, places, and moments in life that bring us true happiness. Maybe you're like me and you've tried to push it aside or ride out the anxiety storm. I don't have time to focus on that right now, or once this moment in time is over, I'll be able to focus on me again. It's incredible how full of excuses we can be when it comes to our own self-care. There's some buzz going around about acceptance and commitment therapy, or ACT. ACT focuses on values-guided action and placing an emphasis on things that really matter to us deep down, while also accepting that pain and stress in life are unfortunately inevitable. As behavior analysts, we really like to solve problems, but ACT approaches anxiety a little bit differently. As Stephen Hayes puts it, ACT requires you to shift from a problem-solving mindset to a mindful acceptance mindset. This means ditching the thought of completely eliminating your fears and pains altogether, and instead acknowledging, accepting the elephant in the room. In ACT Made Simple, a book that I highly recommend, Russ Harris breaks down ACT for beginners. One of ACT's core messages is to accept what is out of your personal control and commit to taking action that enriches your life. ACT is based on behavioral science. If you begin to look at some of your favorite inspirational leaders and their stories on success and productivity and happy lives, you'll start to see some parallels to the ACT literature, which is really interesting because a lot of that is probably done unknowingly. While diving into ACT, I've really been trying to focus on one thing at a time. So while this week, not particularly painful or filled with anxiety, I've been focusing on making conscious decisions that are in alignment with my values, which has definitely taken some deliberate pivoting when I notice that I'm doing something, scrolling through my phone, scrolling through Instagram. I really check myself back in and think, is this in alignment with my values? What's important to me? Most of the time it's not, and so I will make a conscious decision to shift what I'm doing to be in more alignment with my values. Keep in mind, this is a very brief introductory overview, and the ACT research and principles go much deeper. If you're like me, and probably like many of the learners that we work with on an everyday basis, and you've dealt with the overwhelming effects of living with anxiety, I encourage you to familiarize yourself with some of the ACT literature. I'm going to be diving into the principles of ACT and putting them into practice in my own life. So follow the BDA channel for how you can learn to do the same.